Hello again. I don't have a presentation for a very specific reason. The program of the conference actually covers a very complex continuum of issues, which is about science. And I would like to put on the table some provocative points, let's say, for thinking and discussing what we have experienced over the past few years in public health around data and information and policy making. So I will make some remarks about 6 points on this continuum. One is the data, the other one is evidence, then it's about information, then it's about communication, it's about policy making, then it's about the feedback into the process, to step one. And but before I do that, I want to say that I find it most fascinating that in 2021 and 22, we are trying to make a case why people should use science to understand what is going on around us and how to act on that. This was the kind of discussions when there were new emerging theories supported by evidence that actually the Earth is round, right? And that we are not center of the universe, but that we move around the sun. So this was hundreds of years ago. And yet, in the 21st century, suddenly, during the pandemic, we have a situation where significant portions of the population in the world, and more surprisingly, a worrying percentage of well-educated people change science, right? So, and what is even more worrying is that in the public discourse, those who use science and those who do not use science are put at the same level. So we are told, look, every view is equally valid, and you should go and you should find a compromise. Well, I think the simple answer to that is, you can improve or change science and the results of a scientific method only by better science. You cannot confront it with beliefs, because beliefs belong in church and not in science and university. And views, fine, we can discuss because we may have different interpretations, but our opinions don't matter, because what matters is evidence that we can control, not what we think, but what we have proof. So I think this is a really fascinating thing about the 21st century. I never believed we would go to that point again. Now, how did it happen? Why did it happen? Obviously, COVID pandemic was an event like we did not see in more than 100 years. So it's once in several generations that it happened. It took us by surprise. Everybody was taken by surprise. Everybody. And the interesting thing, I think, in the end was that in some aspects, the developing countries fared better than the most developed countries in terms of the response and in terms of implementing some basic public health interventions from vaccinations on, right? And I think this is a very important question for every government around the world to think, how are we going to deal with the next public health emergency, global public health emergency? Because we know it's going to happen again, we just don't know it's going to happen again, and we don't know what kind of virus or other form of living things are going to cause it, right? Because even before the COVID pandemic, people who were in the business of monitoring local preparedness and looking at global public health, they were saying within the next 10 years there will be a pandemic. Okay, so it's not as if we were not warned, and it's not as if the countries did not have a red flag raised, and yet surprisingly little was done in many places in the world. Czech Republic was actually devastated by the pandemic from the public health perspective. in the 2 years of the pandemic, more than 40,000 people died from COVID, because of COVID. If things were done differently to these 2 years, probably, and it's my very top of the head estimation, probably we could have saved 20,000 of them. Maybe more, maybe less, but basically all of those deaths were preventable. Each of these people would have lived at least 1 week longer, and some of them lived 40 years longer. So it had a tremendous impact on life expectancy in the country. It's in the order of anywhere between 1.5% and 2.5%, depends on how you calculate it, and segregated by gender. So the impact on men was much higher than on women. But losing 2 years, up to 2 years of life expectancy in 2 years, brought us back somewhere about 15 to 17 years back. At the beginning of this century, the life expectancy in Czech Republic was the same as it is now because of COVID. So 15 years, let's say 15 years of every crown that was spent on healthcare and on public health and on improving the condition of our cities, or the air quality, the water quality, the food safety, or whatever, was lost, erased, because of the kind of the response that has been mounted in this country. So I think we should not, because life goes on, wars happen, like the war in Ukraine, other issues take over, such as price of gasoline. That's the top news on the radio this morning. How much costs the gasoline of all the problems, right? So these things take over the focus of policymakers and of the populations, and we still live in the middle of the pandemic, right? The last news on the radio this evening was that we had 6,000 newly reported cases. We don't know, does it include the reinfections or not, because they're calculated separately by losses. So it's not really clear who is counted and who is not counted. But 6,000 cases a day, that is a level that we had toward the end of September 2020. Okay? So that was the moment when incidence and mortality went through the roof in Czech Republic. Today, we don't blink our eye. Now, people are not dying like they were dying in 2020 because we had a lot of people have been vaccinated, a lot of people have been already infected and survived it, have some level of immunity. We have a different variant that is not as lethal as the ones that we had back then. But anywhere between 10 and 40% of people who had a COVID infection, including me, in January, after 3 doses of vaccine and after being very, very careful for 2 years, 10 to 40% of us are going to have long COVID. Okay? And those who follow the literature of COVID and long COVID these days, you will see we have photographs of what happens with our brains because of COVID. Among people who had almost no symptoms of the disease, who went to work, they went to school, right? They have red dots and black spots and holes in their brains on the MRIs. So I think it is no game. It's no game, and COVID is a very, very bad disease. And COVID is a systemic disease. It's not a respiratory disease. People don't die anymore or have problems because of respiratory tract disease, a neurological and cardiovascular disease. So also a country like Czech Republic, what did it do? It actually, by letting things go, like Arnold was saying, well, herd immunity, right? We heard it also, like in many other places. Herd immunity caused that we created hundreds of thousands, if not more, chronic cardiological and neurological patients that the healthcare system will have to service today, tomorrow, and probably 10 and 20 years from now. and that ultimately we will have to pay for through our taxes. So whoever thinks that the healthcare system will continue working the way it works today is really greatly mistaken. Okay, so I just want to say with this introduction that we are talking about some things that we take too easy, probably. Secondly, the policymakers would need to think very carefully about preparing the country for the next health emergency of one kind or another. Because ultimately, when you sum all these things that I put on the table, and I want to repeat, Czech Republic is no exception. There were tens and hundreds of countries who did the same and who basically had the same outcome, more or less, in the end. This is a matter of national security. It's not even a matter of people's health and well-being, it's about national security. So now, very quickly, just to raise some points about the six issues on the continuum. So data. To be able to go through this whole process, we need data. Czech Republic performed very well, I think, in comparison with many other countries, in terms of generation and collection of data. It has, I think, a remarkable information system, national information system, that collects all kinds of data in real time about all kinds of things. The big problem with that data is that very few people have access to it. And we were mostly guided, okay, I will say that like that. But I mean, there is a data, but there was always an issue of access to data. So specifically about COVID, it took about 6 months for the data to be really available in the raw format to people who wanted to do something, to research more responsible. And as the data became accessible, it became the whole understanding and development of communication and of evidence changed dramatically in Czech Republic because finally people could do some science. The second thing is evidence. So having the data and counting sheep and putting it in a graph is not evidence, okay? It's data. So data is handled by statisticians and evidence should be handled by epidemiologists, sociologists, modelers, architects, whoever you want. The data is really handled by statisticians. I think the problem with evidence and then also information that is shared with decision makers and the public was that we left the evidence in the hands of statisticians. So what were we guided through the pandemic in policy making here was the crystal ball of Moody's, right? And the crystal ball of Moody's is still very popular, right? And it's mostly the main source of information in the interpretation and scientific advice to the government. Like in the Netherlands, what we heard from Arnold, we had some, I would say, shining examples in Czech Republic, where desperate scientists of different provenance made efforts to provide a little bit different evidence-based understanding of what's going on and then recommendations to the policymakers, such as the PSOC group at the Academy of Sciences that got involved with modeling. It's people like Daniel Prokop, who was doing sociological research on living with the pandemic in Czech Republic. It was the method group which actually started to flourish the moment it was thrown out of the Ministry of Health and became independent, right? So I think in this sort of bleak story about how we underperformed during the pandemic, there are great examples of how there is a capacity and potential in this country to actually come with brilliant things, even at the time of great desperation. So, going to the end of my points and my intervention, we come to policy making. I think we should not have any illusion about policy making. We always say, oh, policy making should be evidence-based. I think it's a wrong expectation because policy making cannot be evidence-based. Policy making can only be evidence-informed. right? And I think it's very important that the decision makers listen to science, listen to evidence, use the information, but they have to handle other issues in this context that is not evidence-based. You know, it's like what Winston Churchill said, you don't want to know how politics and sausages are being made. So I think that in this continuum, there should be robust research, there should be robust development of evidence so that we can make policy decisions as best as we can. But we should not have false expectation that it's going to be a translation of the evidence that into policy. And then the final thing is that once it's all done and we come to the last point, we should also peek back into the beginning of the story, because this is what science is about. Once we have a theory and a concept and a model, we test it, and then based on the test results, we actually go back to step one and we create better science. So I think the same is in the story that I tried to tell you now. Thank you.